Welcome to a special Smile Rejuvenation edition of Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein, and thanks for joining us. On today's show, we take a look at just how simple and easy it is to have that beautiful, healthy smile you've always dreamed about. If you have crooked, broken, discolored teeth, maybe you're missing a tooth or wear dentures, or you're just not happy with your smile, then stick around. You're about to find out just how quickly you can change your life. We'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
In studio today is the cosmetic dentist everyone is talking about, Dr. Dan Pestana. Dr. Pestana is widely recognized as one of the Bay Area's top cosmetic dentists and a leading authority on oral health care. After graduating from St. Mary's College, Dr. Pestana went on to receive his DDS from the prestigious Creighton University Dental School. Dr. Pestana has built one of the most successful and respected dental practices in Northern California. We've invited him on the show today to talk about the artistry and technique involved in properly rejuvenating your smile. Dr. Pestana, welcome to the show.
Thanks, Mike. I appreciate you having me on the show today.
Okay, we've invited you in to talk about how to properly rejuvenate a smile. But before we get into that, tell me a little bit about your background and why you chose Walnut Creek.
Walnut Creek is just a lovely town. It's just the place that I wanted to live the rest of my life at. I went to St. Mary's College and lived in Walnut Creek for a little bit, and then went off to dental school, and then decided I want to raise a family here in Walnut Creek. It's a beautiful area.
We're going to talk about rejuvenating smiles.
Yes.
The buzzword, the key everybody talks about is veneers. What actually are veneers?
Veneers are basically porcelain facings to cover the teeth to make them look more natural or straighter.
Now, are they very big? Are they thick? Are they fragile?
Oh, in your hand, they're a little fragile, but once you bond them and glue them to the tooth, they're extremely strong.
So what kind of problems can you take care of with just, because we're going to talk about implants, we're going to talk about but just with veneers, is it easy? Is it simple? Is it complicated? How long does it take?
It's pretty straightforward in the hands of the right dentist, and patients love them. They really can give you that, kind of the buzz phrase is instant ortho. If somebody doesn't want to have to go through 2 years of braces and whatnot. Now,
can you actually
they can straighten them up in 3 weeks.
So 3 weeks. In 3 weeks, I come to see you. I've got a bad smile.
Correct.
Can you change the color of teeth with them?
Oh, yeah. Yeah. You change the color, the shape, the contour, the texture. They shouldn't be smooth as glass, like a window or anything like that. The natural teeth have some topography to them. They've got some divots and round shapes.
Are the ones that are smooth? Because some people you look at, you know, and my favorite thing is, can you spot a good veneer job?
You shouldn't be able to spot a good veneer job.
You look at some people and the teeth they're all white.
The chiclet look?
The chiclet look. I mean, does that happen because of the dentist, because of what he has to work with, because of the lab?
I think it has to do with the dentist and the lab that dentist is using. You want to have a cosmetic dentist who understands the human nature, the human biology, as well as a lab who understands that dentist is looking to mimic nature.
Okay, somebody's at home, they want to get their teeth done,
they're
nervous, they don't know what happens. Kind of take me through the process. I come in, I know I want a better smile, I sit down, is it painful, and how long does it take?
No, it's not painful at all. Dentistry now, in 2005, should be painless. What end up happening is you'll come in for a new patient exam, we'll do a workup for you, examine you, and then when you decide you want to start the process, about 3 weeks after that, you'll have a new smile.
Can I kind of get an idea of what they're going to look like before you get started?
That's part of our smile design. You need to do that to ensure the right result or the end result that the patient's looking for.
Okay, I want to get into the smile design, but before I do, you said dentistry should be painless.
It should.
Are you painless actually physically or anxiety-wise? Because I know myself, when I go to the dentist, my anxiety levels, more than any other doctor in the world, go through the roof.
Right.
So is there something, if I have anxiety about going and getting it done, can you help me deal with that also?
We can, yeah. For those people who aren't so worried about the pain end of it, but the physical pain end of it, but the emotional pain end of it, and those who have the white coat syndrome, we can give them anti-anxiety medications to calm them down and relax them. Nitrous oxide, we do music for the patients. They can listen to a CD to calm them, relax them, watch a movie if they want.
We have a movie screen in the office?
We've got 3D movie glasses that you can wear.
So you put on the glasses and you watch them?
Put on the glasses and put in
Do you think that
your movie.
The leading cause of people not going to get things done is the fear or the anxiety of the
I think it's, I definitely think it's the #1 cause of why people stay away from dentistry. We've unfortunately, had a bad rap for quite some time, and nowadays with the dentists in the dental profession wanting to help people, we've realized that and made strides to make sure that it's easy for patients.
Smile design.
Yes.
And I promised you I wouldn't put you on the spot too much about who does what.
Right.
Tell me a little bit about how a proper smile design should be done.
Proper smile design should be done in a way that gives you and the patient all the necessary information. For the end result, you should actually, before you seat the patient in the chair, know what your end result is going to be.
Because I talked to you and you said that if they're done wrong, although it's not a big issue to help you, it can actually change your speech pattern because you form words by placing your tongue against your teeth.
Exactly, and teeth against your teeth.
And it may also affect a little bit how your teeth come together.
Correct.
So what do you do to ensure that that's not going to happen before we get started? Because once it's done and they're in, the teeth are ground, you can't get it back. So what do you do to make sure that that doesn't happen?
We go ahead and do a complete smile design where we are actually doing a final mock-up of the teeth, and we have diagnostic mountings which will mimic the movements of the human jaw. And then,
so you're going to know how my teeth are going to work and close before we ever get started.
Exactly, and we're going to do that mock-up and that design to fit your specific bite, because we don't want to alter or do any harm, especially with your jaw joints.
Do you think that that is a standard practice through the industry?
I would like to think it is, but I don't think it is.
Is that a polite way of saying no?
Yeah, it's a polite way of saying no.
Do all dentists do veneers? And exactly the same?
No. Some...
Because I know you brought in some cases. You're the first one I've talked to that's brought in cases where you used composite material because they were young or because of this stuff, rather than just grinding the teeth down and sticking a veneer on.
Yeah, the veneers are not a panacea for everything. You have to make sure that you're doing no harm, basically. You need to make sure that the candidate or your patient is right for veneers, and veneers are right for your patient. You just don't want to throw them on, because you're right. Once you've cut down that little bit of enamel, you can't get it back.
Not to put you on the spot again, but what would you say are some of the things that can go wrong if you put yourself in the hands of an untrained or inexperienced dentist to have that type of work done?
Well, the smile may be canted, it may be shifted. You may end up with jaw joint issues. You may end up breaking the veneers that you've put on by them not being in the right position, by not doing the mock-up. And then you may get patient dissatisfaction because of the look.
Does experience play a big part in, do you get better over time as you do veneers?
Yes.
You start to learn a little better?
It's like with anything. The more you do it, the better you are at it, and the easier it gets.
All right, we're going to have to take a quick break.
Yeah.
When we come back, I want to get a little bit more about how they're actually put in and what we can do with implants and a little bit about gum disease.
Okay.
You're watching Medical News Network. We'll be right back.
Mr. and Mrs. Jones, Sally's having some behavioral problems.
I guess that reward system isn't working.
Well, the timeouts weren't either.
Parents do find that timeouts aren't...
See?
Well, you're just too lenient.
Well, you're too strict.
No, you are.
Oh, you are.
No, you are.
No, you are.
When adults don't have the answers, they can feel as frustrated as kids. ConnectForKids.org has thousands of resources for helping kids in your community. ConnectForKids.org, guidance for grown-ups.
Almost half of all parents who suspect their child has a problem learning wait a year or more before getting them help. Why? when there's so much they could be achieving. Kids with learning disabilities are smart. They just learn differently. Call or visit us on the web now.
Welcome back. We're talking about easy options to obtain the beautiful and healthy smile you've always wanted with Dr. Pestana. All right, before we went to break, we're talking about veneers, and we're talking about composites and other things. I know you brought some pictures, so let's just get into it and start talking about what you can do. You told me that veneers aren't always the only option, that there are composite. What's the difference between composite and veneer?
Composites versus veneers, they really run the gambit there for treatment options. You want to have options for your patient. And the composites, they just aren't as durable as the veneers are. But sometimes you have to use a composite for that.
All right. The first gentleman we're going to take a look at has the split between the two front teeth.
Right, he's got the gaps.
Very common problem, causes a little whistling or lisping when you talk.
Right.
You know, and obviously as children we poke fun of everybody, but how difficult is that to treat?
Not very difficult at all. It's very, very simple. The pictures we'll be looking at, in his situation, he wanted veneers, but physically, with the way his bite is, we couldn't do that for him, so we did the next best thing.
Well, now, but this is what I want to. You said that you told me that before. Physically, you couldn't do it. Right. Could you have put veneers on his teeth?
Yeah, we could have, but they might have broken, you know, and that would have been a disservice to him.
All right, so people come in, they want veneers.
Yeah.
It's maybe not the best option.
Right.
You kind of give them other options. All right,
we give them other options. Yeah.
Let's take a look at his picture real quick. We'll bring that up. Okay, so he has a pretty even split right between his front teeth. Now, what about the left front tooth? Is it also kind of?
It's a little chipped, cracked at the edge there, and he wasn't happy with that. He wanted teeth that looked even, symmetrical, and he wanted to fill the voids between his front teeth.
When you put composite material on, is it pre-formed before you put it on, or do you kind of form it as you?
With these, you form it chairside. So
now,
in the office.
Can you match the tooth color?
I can, yeah. Nowadays we have fabulous composite systems that will mimic the human tooth very well, and so we can do staining and different shadings and everything. So,
but you say that they'll do that, is that in the hands of? I mean, I obviously couldn't sit down with somebody and do it. I mean, is there a little bit of artistry involved?
Yeah, there's a bit of artistry involved, and what you have to do is sit with the patient. You're doing a miniature smile design when you're doing the composite gap closures and composite veneers, but you have to have artistry so that it blends in. And it's the right color of tooth-colored filling to the right color of tooth in that one area, because some teeth have 2 and 3 different colors.
Right, I noticed his teeth are a little bit yellower up towards the gum line than down at the end.
Right.
All right, let's take a look at his after real quick, and let's see. Oh, well, that's incredible. What a great smile he has.
Yeah, he absolutely loves it.
That's a very happy man right there.
Yeah.
And I'm sure, was that right after he got to see the work?
Yeah, right after. And he was worried that it was going to break. He was like, well, how strong are these, Doc?
How strong are they?
Oh, they're very strong. Once you bond them and glue them on to the tooth, kind of like veneers.
Now, this is the same material basically that you would use in a filling in a back a molar, so it can take the load of...
Yeah, the composite fillings now have virtually the same compressive strengths that the metal ones do, but you get so many more benefits with the tooth color.
And he doesn't end up with too big shiny silver or gold teeth up front.
Exactly.
Right.
And we don't have to worry about the breakage with his particular situation. I gave him an apple. He was worried about it. I went to the reception area. I have fruit and water for my patient.
And had him bite right into it.
And I had him bite, and I took a picture of him biting it. I got that in my office too.
All right,
so
let's move to
we had some fun.
The next one. Now, tell me a little bit about this. This is a young lady.
Young lady. She at the time she was about 13 years old. Very self-conscious. She didn't have the best oral hygiene. And she had a lot of cavities. And then, of course, the gaps between her teeth, she really hated those. You know, a 13-year-old girl, that's detrimental to her self-esteem. So
psychologically speaking, it's very... Now, you said she came in right before her school pictures?
Right. We had seen her as a new patient, and we were cleaning up the bacterial infections in her teeth and gums. You can see on the right side here how red the gums are. She technically had gum disease as a 13-year-old.
Now, can that be caused a lot by bad teeth? If your teeth have cavities, if they have, I mean, does the bacteria that breeds in there go right into the gum?
Right. The bacteria that is naturally in our mouth gets out of control, and then it causes disease processes and damage to the soft and hard tissues of our teeth.
All right. You told me with this young girl, if she hadn't have done something,
right, she would have lost her teeth.
She'd have lost most of her teeth.
Yeah.
Because the gum disease alone causes the bone to recede and the teeth to come loose.
It does.
All right, now.
It does. The bone is your foundation, and that bacteria creates toxins that dissolve away the bone.
And you made a comment to me, and I always thought, growing up, my mom always told me that when you brush your teeth, your gums should bleed a little bit, because that meant you were brushing them hard and you were doing a good job.
Yeah.
You told me that your gums shouldn't bleed no matter how hard you brush them, that any bleeding of the gums is a sign there might be a problem.
Exactly, yeah. You don't want to have any bleeding when you brush or floss. If you do, you need to get to your dentist and have them check them out.
All right, so this young lady's 14 years old.
Right.
There's many options. I talked to someone a while ago that actually had veneered somebody that age, and the teeth weren't fully erupted, hadn't grown all the way out.
Right.
And you were able to, by the time she was 21 or 22, you could.
Right.
But they'd already done what they ground down the teeth. Now, what did you do for her? Because you said it was important not to grind away.
Well, at 13, when she presents to me like this, she hasn't been taking care of her mouth. So are we going to spend all that time, energy on doing veneers for her when maybe she's not going to take care of them like she needs to? And like we talked about earlier, once you shave down that little bit of room you need off of the tooth, you can't put the enamel back. So in her situation, the best thing to do for her was to do some decay removal. We did fillings. We had to remove some of her tooth structure on some teeth to clean up the infection. But then we added the composite and filled in the voids and got rid of the dark brown spots.
That's incredible. Now this was all done with composite material.
All composite.
And I noticed that the redness around the freehand. So this was all done by you sitting in a chair designing it. And I noticed the gums are not so...
composite kit out with all the colors and, all of it.
Okay, and then the gums are much nicer too.
Yes, yes, they are.
And these are just as strong as anything else. All right,
yeah.
We're running out of time, but I want to look at one more picture real quick.
Right.
And just because this gives everybody an idea, this is a lady that had in the front there, you can see kind of the gum. Is that the gum receding?
That's the gums receding. You're actually looking at her root right below the crown, and those are old style.
On the left there, what's being held up? Is that?
That's a shade guide.
So you can now match the teeth.
I can now match the teeth. Yeah.
All right, and then we're gonna look at the after just real quick. And you only replace the front two teeth.
Just the front
this
two.
lady's teeth, obviously next to the gum line, are yellow-ish, not bad.
Right.
And they go to very clear and translucent on the bottom. And you wouldn't, the line through there runs equally in all those teeth.
Right, and this is age appropriate. We're trying to mock
because
nature.
you see people with bright white teeth at 50 years old, you know there's something wrong.
Right.
All right, we got to take another quick break. When we come back, I want to look a little bit more at the veneer cases, and then I want to talk to you about implants and what you can do to stabilize dentures with them.
Great.
You're watching Medical News Network. We'll be right back.
This is the hand that sows the seed, that grows the forest, that gives shape to the wind, that carries the kite, that is flown by the child, that is loved by the woman, that gives to EarthShare, that supports the hand.
EarthShare is the workplace giving program bringing the leading environmental groups together. Support EarthShare, support them all. To learn more, please visit our website.
When it comes to babies, appearances can be deceiving. Look at this brainwave. Very active. And this one, not doing much. You make the difference by reading, singing, and talking from birth. Studies prove it. An early start. Now that's smart.
Welcome back. In studio, we have Dr. Dan Pestana, and we're discussing easy and convenient ways of obtaining a more confident smile. All right, Doc, I know we've got a bunch of pictures I want to get to.
Right.
So I'd like to give you a lot, but we're going to have to move through them a little quicker than normal. So let's just get right into it. Tell me about this gentleman, the next one we're going to see here.
Oh, this is a great young man. He, as a child, had a trauma. So these are his permanent teeth, and as a child, we get our permanent teeth starting at about age 6, and then as we get through the teenage years, we get them all.
Right.
That we're going to have for the rest of our lives. And he traumatized his tooth, needed a root canal.
Maybe hit a handlebar, fell down.
Exactly, and he had a micro crack, and then over the years, it's gotten bigger and bigger. Well, that bigger crack has now stained. It's an eyesore to him. He just doesn't like it. It's a confidence
was that
problem.
tooth? It had a root canal, so the tooth basically he can't feel that crack.
He can't feel that
very
crack.
Painful.
Yeah.
But it's like anything. It's a new car. If it's got a ding in it, you're not attracted to how beautiful the car is. You see the ding. All right. So what'd you do for him?
We ended up cleaning that situation up by putting an all porcelain crown on his tooth. And we whitened his other teeth a little bit, and then we made him an all porcelain crown, bonded it in, and now actually that tooth is stronger with that.
Do you normally whiten
seal
people's teeth before you start?
A lot of time, yeah, we do. Because people usually want a lighter, brighter, younger looking smile. The whiter they are, the younger they appear.
Okay.
So yeah, most people do.
All right, let's take a look at his after. Now you did just one tooth on this gentleman.
Yeah, just one. Just one.
So now the right front tooth now
correct
is a complete crown.
It is.
The coloring though matches does the lab do that for you? You send them a picture. You told me you use a local lab. Yes?
I do. Yeah, Paul, he's awesome. Do you
think that makes a difference in the quality of work you're able to do?
Oh, he's absolutely fabulous. Yeah, you have to have a fabulous lab technician, fabulous lab to get these kind of results.
You have a personal relationship with him because he's close?
I do. He and I are in the Seattle Study Club together, which is an international
it's a very
study
elite club. I've heard of that.
It is. And he and I are part of it. And you have to. He understands the aesthetic needs that I want, as well as what our patients want.
Well, that's
so he can give me a true lifelike tooth.
Well, that one I would never guess was a crown. I mean, that's incredible. And now he no longer has to worry about his smile. He probably smiles much more.
And the
often.
tooth's actually stronger.
All right, let's take a look at the next one here.
Yeah.
Now, what did you do for this gentleman? Obviously, his teeth they're spread apart. They're kind of angled out.
Right. Right.
They're
gaps. Yeah, he had a lot of challenges. Younger gentleman in the corporate world was very self-conscious about this. We ended up doing 8 veneers on him.
Do you think when people don't smile, they're perceived as being grumpy or unhappy?
Yeah, yeah.
Even though really all they're trying to do is hide their teeth?
Yeah, and you got to use more muscles to frown than you do smile. So,
well, that's much. Okay, so you did veneers across how many? 8?
We did 8.
All right.
For him. Yeah.
All the way across the front.
All the way across the front.
You able to close the space?
We closed the gaps.
Can you make the teeth look like they're straight again?
We made them look natural. We straightened them out in the right directions, color, size, phonics. He was able to speak
All right,
better.
Let's take a look after the after. That's the same gentleman we just saw, and now those teeth they look straight.
Exactly.
They don't by any means look fake. They have that natural start a little darker and get lighter towards the edge.
Exactly. They look natural. They're age appropriate for him, and they just gave him a boost.
Right,
his personality was
and again,
a little bit different.
I've noticed that all your patients that we have the full face on all seem to be
big smiles.
Big smiles.
Not just the smiles, but look at the eyes.
Oh, no, I mean, they're
the
natural.
eyes are bright and happy. And
well, he's got to love that smile.
He does.
I mean, compared to what he came up from. Do people tell you it makes them feel more confident? It makes them feel more youthful?
It does. It
changes their life? All right, let's move to this one. Now, we're going to talk about implants.
Correct.
Okay, this was an implant. Just quickly, what is an implant actually?
An implant is really a man-made root. It's made out of titanium. Kind of like the same material they use for hip surgeries and whatnot. And it slides into the jaw.
Is it a pretty predictable procedure?
It is. There's a 95% success rate with implants now.
That's probably one of the highest.
It is. It is more predictable. And now, instead of, it is the standard of care for our practice. And for most dentists too. Because now, instead of having to cut down the two adjacent teeth.
Let's look at this picture.
Yeah.
Missing one tooth.
Exactly.
2 very healthy teeth, obviously, on both sides. They look good. I might be wrong. Traditionally, what happens to this patient? They go to somebody. What traditionally would happen?
Traditionally, what would happen, the dentist would say, okay, Mrs. Jones, we have to do a bridge for you. We'll cut down the 2 adjacent teeth. perfectly healthy teeth. These are perfectly fine. Nothing's wrong with them, but you have to cut them down to make room for that bridge, which you'll put a fake tooth on and put that into the space.
All right. The bone below it.
Correct.
You told me that
Yeah.
without something in there to stimulate the bone, it recedes.
Exactly.
Is that why sometimes I'll see people with a bridge and they've got space between that tooth because the bone continues to go?
Exactly. When they make the bridge, they put that fake tooth right at or into the gums a little bit to make it look good.
Right.
But over time, that bone's going to go away. It's
Right.
going to resorb. It's going to shrink away.
What are some of the other traditional problems of a bridge?
Traditional problems with a bridge are keeping it clean because you have to use special devices to floss it, to brush it, and it's tough to get underneath into those spaces, and the bacteria likes to hide in those spaces, so you got to get it.
How long does a bridge last?
Well, I would like to see bridges last anywhere from 10, 15, 20 years.
How long do
But
they?
typically, what we're seeing is they're lasting about 3 to 5.
Okay, so an implant, you put it in, you replace a single tooth. Let's take a look.
Yep. Minimizing
That's
treatment.
incredible. Now she's done. She doesn't have to do anything else. Doesn't have to worry about the bridge
She
breaking.
needs to come in for her cleanings every 4 to 6 months.
And that's just like a regular
brush
tooth.
it,
Nothing happens to the
floss
tooth
it.
around it.
Nope.
All right, last one. We're running out of time, but I want to do this one very quickly. This gentleman's a mess. There's no teeth on the bottom. The front, the gums are, I mean, this is, he's got to know this. It looks like he's had complete upper dental work done.
He has.
Okay.
He has.
Are there people out there with these problems that don't come in because either they're afraid, they don't think there's a problem? I mean, he has no teeth.
Right. He actually had no pain. But when you look at the gums here, they're oozing the blood. So that if you had a cut on your hand like that, you'd be to the emergency room.
What do you do to fix that? I mean, obviously he's going to lose those teeth.
Well, he's got severe gum disease. We ended up having to pull all of those teeth because there was so much bone loss. There was nothing really holding them there except for the gums.
Okay,
and
so
that's
now
not
he's going to get a
supportive.
denture.
And now we go ahead and instead of doing the classic denture type treatment, we can give him a modified denture type treatment where we're actually putting in implants, which now will support the bone and keep it from melting away.
So he puts a denture on that implant, it locks in.
Locks in.
Doesn't need to put polygrip, doesn't need, can chew, can do, and let's look at his after.
Yep, and that's
I mean, obviously his wife's got to love kissing that more.
Yeah, and he smiles more now, and he's a great patient. He was in his 60s at the time when we did this, and he's a funny guy, and he laughs more now and smiles more now than he did before.
We're completely out of time. If people at home watching this show, I mean, you're incredible, but if they're at home watching this show, if they can remember one thing, what message would you like to leave all the viewers with today?
I would like to leave them with that dentistry is painless, and that we can give them back their healthy smile again, and their smile is their best first impression.
Doc, I want to thank you for coming on the show. You've been incredibly informative, and we'll have to have you back.
Mike, thanks. It's been great today.
Thank you. You've been watching Medical News Network. For more information on this subject or any other, please visit our website at medicalnewsnetwork.info. For now, I wish you good health.